This is from Kim in Texas. Dear Dr. Ray, I have been having anxiety attacks for about 6 months, about every 7 to 10 days. I'm on medication, but the nearest counselor is an hour away. I read that writing about the attack, mid-attack, could help end it. It worked. My latest attack came after 14 days and ended in 15 minutes as soon as I started writing my journal. How does journaling help end an anxiety attack? Anxiety is the #1 psychological symptom. It is the most common symptom. Anxiety scares people because in and of itself, it's a fear response. If somebody were to break into this studio threatening all of us, you would all be anxious. Everybody here would be anxious. You would have a response wired into your body, danger, danger, danger. Anxiety is the same response with no danger, no danger, no danger. Something is triggering the anxiety. Usually it's the way you think, it's your experience of a situation, or it's just random. What happens is when people have anxiety, they think all kinds of terrible things. I'm having a heart attack. I'm losing my mind. I'm never going to be normal. This is horrible. I was in a workshop not so long ago on anxiety, the latest techniques. Fascinating shift in how to deal with anxiety. It used to be that we thought you have to fight it. You have to grit your way through it. You have to distract yourself from it. No, no. You know what they say? They say you have to accept it. It's not going to hurt you. It's going to go away. And it does. All anxiety eventually goes away. Even if somebody broke into this studio and threatened all of us, after about 2 hours, some of us would have no anxiety left. The chemical would have died out. We would simply sit there wondering, okay, what's happening next? And furthermore, some of you might be thinking, this guy's less scary than Dr. Ray. Okay. So first of all, when you write about it, what that does is it makes you aware of what's happening in your body, and it reduces the fear of what's happening in your body. One of the great therapeutic questions in anxiety is this. Your last anxiety attack, what did you fear would happen? What did you think was the worst thing that would happen? Now, many people would say, well, everybody's going to see how anxious I am, and they're going to think I'm weird. I'm going to faint, which never happens, by the way. It's physiologically impossible. Okay? Anxiety raises blood pressure. Fainting is lowered blood pressure. So everybody worries about fainting with anxiety. It's just not going to happen. So in writing what's happening in your body, what it does is it almost makes you accept it. Oh, my heart is racing. I'm breathing hard. I'm starting to sweat a little bit. Nobody is noticing anything. They're going about their business. And what you do is you basically pull the plug on the fearful component of anxiety, and it does work. There's another technique similar. You go in front of a mirror, and you talk and describe the symptoms and the worry. They're called worry appointments. And what you teach the client to do is twice a day, 10 o'clock, 6 o'clock, you have your worry appointment. You go in front of the mirror and you spend 10 minutes just conjuring up everything you can. And what tends to happen is people after a minute don't know what to say anymore. It's like, what was I worrying about? I can't even come up with anything anymore. That's right, because anxiety is very vague. All I know is I don't feel good, but what are you worrying about exactly? Well, I don't know. Am I going to be able to drive my car? They can't. It's hard for them to put it into words.